This is One on One. Bob Garrett is President and Chief Executive Officer, Hackensack University Health Network. Good to see you, Bob.
Good to see you, Steve. Thanks for having me.
Great having you. Last time we were here, since last time, a lot has happened.
Yes.
We're about to go to a video clip from an opening, big opening, Hackensack UMC at Pascack Valley. Back on June 1st, a big opening. About to see Governor Christie on this. Why is this opening of this hospital so significant in New Jersey and in the nation?
It's the first newly licensed hospital, Steve, in an entire generation in New Jersey. It's been 30 years since a new hospital was licensed in New Jersey. For the residents of Bergen County, northern New Jersey, the Pascack, Northern Valley regions, this was a huge deal. They were so used to having Pascack Valley Hospital, very convenient, very accessible.
Closed down.
And when it closed down back in 2007, they were really without access to a local hospital. So it was really our mission to reopen it. We wanted to restore the essential healthcare services to that community. And I have to say the community was great all the way through. They were very supportive, never wavered. The elected officials, the folks that live in the community, the ambulance squads, the doctors and nurses, everybody was on board throughout the entire period while it was shut down. And that, at the end of the day, made a difference in terms of it getting approved and the hospital being reopened.
Well, you saying it is one thing, and that's important. Want to hear the governor say it?
Sure.
Let's take a look at Governor Christie back on June 1st at a very important opening.
We know that providing quality health care to the citizens of our state is one of the most important responsibilities of government. And so I'm thrilled that as this process went forward, and I know it's never as fast as people want it to be. But what I also know is that what matters the most is that you come out to the right result. And I'm thrilled this morning that this is happening and that we can be part of it together.
Bob, that day, I mean, because, you know, full disclosure, I've said this before, I've done some teaching, coaching, and at Hackensack. I know the organization well, and I remember you guys getting ready for this. That was a tough decision to go in and do that. I mean, you have to make a decision. Hey, we're going to do this. We're going to enter into this. What goes into a decision when a hospital closes down because the economics don't work, it's a tough situation? What goes into a decision, hey, we're going to step in and do this? It hasn't been done in 30 years.
It hadn't been done in 30 years. Frankly, there was a lot of risk, but what we assessed was what I said before. The community support was really very, very strong. We felt from the beginning the hospital didn't close because of a lack of need, because of a lack of community support. There were unfortunately some poor management choices that were made in the past that led to the closure, but we knew in our hearts that it was the right call because there was a lot of support in the community. We felt the hospital was really needed. The essential services should be restored. So at the end of the day, the governor's support, the commissioner of health support for this project obviously made all the difference in the world. But you know what? They did hear the voices of the community loud and clear.
Economic impact?
Huge. You know, just having a thriving hospital in a community brings back, you know, literally hundreds of jobs.
As opposed to a shell?
Correct. So hundreds of jobs right at the hospital, plus local businesses being restored. When the hospital closed, restaurants went out of business. Local businesses did close up or relocate, and we're already starting to see that resurgence of the business community since June 1st.
You know, it's interesting because we've talked about a lot of this off the air, and we talk about partnerships, we talk about mergers, we talk about relationships.
Right.
You're big on this.
Yes.
Very big on this. Mountainside,
right.
Another hospital. Went through a lot of changes in the community I live in.
Right.
Okay. Now is known as?
Hackensack UMC Mountainside.
Got it. That's just one of many different
Right.
partnerships. Why are these partnerships, and that's just beginning to scratch the surface, why not just say, look, we're just going to be strong ourselves,
right.
We're going to take care of ourselves, our own bottom line, and we're not going to be into all these partnerships. Why can't you? Why don't you do that?
Well, you know, you have to recognize that you can't be everything to all people, and you bring partners on that have certain skills. So with respect to Pascack Valley and Mountainside, our partner is LHP. So what do they bring to the table?
What is LHP? Put that in context.
It's a private hospital firm out of Texas. So they bring essential capital to the table, and they bring management expertise. Our forte at Hackensack is really running an academic medical center, one of the largest in the country. Their forte is really running smaller community hospitals, so they have that expertise to do each and every day. And they bring essential capital to the table. Let's face it, it's expensive to grow a network today. We want to preserve some of that capital back at the flagship hospital, Hackensack University Medical Center. This gives us the opportunity to really expand our network through this partnership in a very, very swift manner with a partner that's well known, that's grounded, and that can bring that capital and management expertise to the table.
The other thing you've talked about with other hospital executives we've had on, Bob, has to do with the advent of what's about to happen as we do this program as we get toward late summer of 2013. What are some of your greatest concerns with the Affordable Care Act coming into play? Look, everyone says it's happening in the beginning of 2014. It's been happening.
Right.
Biggest changes you see, biggest challenges and opportunities. Loaded question, I know.
Yeah, I think one of the biggest concerns that I have is that when the Affordable Care Act was passed, there were automatic cuts to the Medicare program that were made to help pay for the additional people that were going to be insured. Unfortunately, there's been delays in some of those people getting insured and being able to access the healthcare system. So there's still a great deal of the population that's uninsured, but those automatic cuts to pay for what was going to be an expansion of insurance have already taken effect. So that's significantly hurting hospitals and physicians. So because of delays in the implementation of the Affordable Care Act, but unfortunately the cuts to pay for that expansion already being in place, it's really a big challenge for hospitals. From an opportunity perspective, I think ultimately if the system can be rolled out like it was originally planned, and people do get the insurance, or at least the folks that were underinsured do have access to good health insurance, I think it's a good thing. It'll be a good thing for our state. It will be a good thing for our nation.
The health exchange, you think much about that?
Yeah, we do. We'll have to see how that plays out. It's
a lot of unknowns.
A lot of unknowns. It's off to a rocky start. I think the federal government did not anticipate so many states not wanting to step up and participate, including New Jersey.
Governor Christie said, "Feds, you do it. We're not going to do it."
Exactly. Governor Christie said that. Many other governors across the nation said that. And I think the federal government, frankly, is a little bit overwhelmed in the implementation. And that's why everything has been delayed. They never anticipated that so many states would opt out, or at least say to the federal government, "You run it."
When you look at your place, okay, because one of the things that always interests me is the U.S. News and World Report always comes out with rankings.
Right.
A real quick synopsis of some of the rankings. We can't go through all of them. Hackensack comes out where?
We come out number 1 in New Jersey. We were ranked in 10 national categories, meaning in 10 clinical categories. We were one of the top 50 hospitals in the entire nation. So by far, that puts us as number 1 in New Jersey. We're also very pleased that those rankings put us in the top 3 in the entire metropolitan area. And if you think about it, you have some of the finest, well-known academic medical centers in the New York, New Jersey metropolitan area. We are in that top 3 with hospitals like Columbia Presbyterian and NYU.
But Bob, here's the reason I ask it. How much does that really matter? I mean, in the scheme of things, everyone fights to want to be there.
Right.
And those who aren't there say it's not that important, of course,
it matters,
for obvious reasons.
Yeah.
But when you're there, what do you do with it?
Well, it matters because first of all, it's a great thing for New Jersey. So people that need specialized care don't necessarily have to travel into New York or to Philadelphia to get that care, because U.S. News and World Report recognizes hospitals that excel in providing specialized care. It's a great reflection on our team, on the quality of care that's provided. It helps us in recruitment of physicians and nurses, creating a very stable workforce. But most importantly, it's a pride for our state and our region to have a hospital like Hackensack University Medical Center nationally recognized by U.S. News and World Report.
And the final 30 seconds, healthcare world is unpredictable and challenging, but you remain optimistic that you can navigate these choppy waters.
I do.
10 seconds or less.
I don't get much sleep at night, but I'm optimistic.
Thank you, Bob. President and CEO, Hackensack University Health Network, expanding every day. Thank you, Robert.
Thank you, Steve.
Thank you.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by PSE&G, TD Charitable Foundation, Prudential Foundation, Roche, the Newark Public Schools, Terrell Fund, New Jersey Natural Gas, proud to support education in our communities, the MCJ Amelior Foundation, and by the Merck Company Foundation. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.